You know, your heart has its own natural rhythm, right? A steady beat that keeps everything in your body humming along. But what happens when that beat slows down? Way down. Today, we're diving into bradycardia, a condition where the heart rate is dangerously slow and what that can signal about your overall health.
So here's our game plan. We'll start by figuring out what slow even means for a heartbeat. Then we'll get into the two main reasons it happens. After that, we'll learn how to spot the warning signs, unpack those electrical glitches called AV blocks, and finally wrap up with how the condition is actually managed.
All right, first things first, what exactly qualifies as a slow heartbeat? Well, it's not as simple as picking one number. As you're about to see, the answer really truly depends on how old a person is.
So by definition, bradycardia is any heart rate that dips below the normal range for someone's age and specific condition. Now, this isn't just a number on a chart. It can be a really serious warning. For instance, in children, one of the leading causes is hypoxia, a lack of oxygen, which is why catching it early is absolutely crucial.
This chart right here just shows you how dramatically the definition of normal changes over time. Get this, for a newborn, a heart rate of 95 beats per minute would be considered bradycardia. But for a teenager, that exact same rate is totally fine, completely healthy. It just goes to show you why context, especially age, is everything when it comes to diagnosis.
Okay, so now that we know what bradycardia is, let's talk about why it happens. The causes are really split into two big categories, what we call primary and secondary bradycardia.
On one hand, you've got primary bradycardia. The best way to think about this is a problem with the heart's own internal wiring. Something's up with its natural pacemaker cells or the electrical pathways. Then, on the other hand, you have secondary bradycardia. This is when an otherwise healthy heart is being affected by outside factors, things like hypoxia, low blood pressure, or even the side effects from certain medications.
You know, a slow heart rate isn't always a cause for alarm. I mean, many highly trained athletes have one. The real danger pops up when it becomes symptomatic. So the big question is, how do we know when bradycardia is actually causing a problem?
Symptomatic bradycardia is the clinical term for when that slow heart rate is directly causing the body's systems to fail. The heart just isn't pumping enough blood, and that leads to poor circulation, a serious drop in blood pressure, and can even affect someone's mental state. This is the point where it becomes a true medical emergency.
And these are the key red flags you have to look for. We're talking about way more than just feeling a little sluggish. This is serious stuff, a measurable drop in blood pressure, actually fainting, struggling to breathe, and even signs of shock. These are symptoms that demand immediate medical attention.
Now, beyond the immediate symptoms, a person's history can provide some really vital clues. Have they ever had heart surgery? Are they taking medications like beta blockers? Is there a family history of heart conditions? Or, tragically, any unexplained sudden deaths? Every single answer helps doctors zero in on the root cause.
Okay, we're about to get a little more technical now. One of the most common reasons for bradycardia is something called an atrioventricular block, or AV block for short. And all that means is there's a disruption in the electrical signal as it's trying to travel through the heart.
So let's break this down. First-degree block is just a small, consistent delay in that electrical signal, and honestly, it often has no symptoms at all. When you get to second degree, that's when some signals are actually dropped completely. Type I is less severe, but type 2, that's always considered pathological, which means it's caused by a disease in the heart's wiring, and it can suddenly get much worse, progressing to a complete block. And that brings us to third degree, or complete heart block. This is a total communication breakdown between the top and bottom chambers of the heart. It's a full-blown medical emergency that requires immediate help, usually a pacemaker, to get the rhythm back on track.
So, we've defined the condition, we've looked at the causes, and we've decoded the electrical faults. Now let's get to the most important part. How is it all managed? We're going to look at both the immediate, emergency response, and the more targeted treatments.
In an emergency situation, the approach is very systematic. First and foremost, you secure the ABCs: airway, breathing, and circulation. Now, if the person is unstable, with a heart rate under 60 and poor perfusion, which just means blood isn't getting to the organs properly, you start CPR right away. Epinephrine is the go-to, first-choice drug. If medications aren't cutting it, the next step is often something called transcutaneous pacing, where pads on the chest send electrical jolts to force the heart into a regular rhythm.
What's really fascinating is that when bradycardia is caused by a specific drug, the treatment becomes incredibly targeted. For example, to fight a calcium channel blocker overdose, you literally give the person more calcium to try and override that blockage. For an opioid overdose, there's a specific antidote called naloxone. It just shows how critical it is to figure out that root cause to give the most effective treatment.
And that all brings us to our final and maybe most important question. We've seen how a slow heart rate can mean you're an elite athlete, or it can mean you're in a life-threatening crisis. It really makes you wonder about the incredible complexity of the heart's own monitoring system and what happens when that system just can't tell the difference anymore. Thanks for joining us for this explainer.